simply misunderstood.
And also, there are times that, of course, especially with your clients, I think you will continue, if you love that particular interpreter, you will continue to keep them for continued sessions just because that interpreter is already familiar with the family. The family, with our other facilities and clients that we work with, they seem to, the clients, the LEP themselves seem to want to have the same interpreter, especially if they really like them. Just so they don't have to repeat their issue again and introduce themselves again and, exposed to another new face. So that is always possible to do that with our interpreters as well, as long as it's not like, the time they are out of the country or something like that. So we always rearrange the schedule if you really have people that you enjoy working with.
So instead of me rattling off a list of thou shalt nots, what do you think are some things that interpreters should not do or that you should assume about the interpreter?
I guess have additional conversation, create a conversation that you're, like Chelsea described, that you're not involved in.
Yep. What else? What might be a red flag for you? How about if the interpreter and the client showed up together in the same car?
Oh. Yeah.
What else?
Well, I always wondered, because we do have one situation that has happened, same interpreter, same client, a few times, where they sit out in the waiting room, like waiting for the applicant to come, and they're just and they like each other, which I love, but I've always wondered if that is like something that, is that considered cool for you guys to do that or not? I mean, I think I kind of liked it because obviously she's very comfortable with that interpreter.
In the ASL world, we're trained to do that.
This was like spoken word.
Okay. Well, so in ASL, we're trained to do that because it helps us as interpreters gauge on the spectrum of ASL to English signing where that person falls. Do they train that way?
In the spoken language, we are trained, like when you arrive to the appointment, you should introduce yourself and, just know you're the right person and, what the appointment is for. But in the real, like, say the provider came in, the treatment started already, the conversation started already, and the provider just stepped out to do a quick phone call or something like that, then you're also supposed to step out. And, when the provider is not in the room, you're not supposed to stay with the client or the LEP only, because it creates, more question and, the client will start sharing you about their stories, and you never know, you may, end up like sharing your stories or like giving an advice or, things like that.
This is a pretty controversial thing in the interpreting world because we have old school interpreters who are like, no, I stay in the room. Like, I don't want the person to be lonely or, whatever. And, and it's really just been in the last probably, I would say 5 to 10 years that interpreters have kind of upped the professionalism in our game and have, as an agency, we tell our interpreters to leave. If the provider leaves, leave the room. But then we have consumers who are like, where'd my interpreter go? You're so rude. Why did you leave me? So it's our stance that the interpreter leave the room.
We actually just had a hospital here in town called and said that your Punjabi interpreter is refusing to stay inside the patient's room, and we want her to stay in the patient's room until the patient has a baby. It was actually liver and delivery. So we explained to them about what the protocol is, and they're like, we understand, but the patient want the interpreter in the room, and we agree, and we want the patient in the room. So as long as we clear that with the provider and the client and everyone, then.
So for those of you that made a comment about the interpreter appearing to have conversation of their own inside the session, not in the waiting room, but during the meeting that you had, how did you handle that? Did you just let it go?
I just let it go because I think for me, it's not necessarily that I was bothered by it, but rather that I have had very limited experience working with interpreters, so I'm not really sure what the expectation is. And having had different experiences, and so I really always want it to be, in the client's best interest. And because I didn't know if she was just providing clarification, because certainly I know that there are some things that in English I would say, but then in another language it doesn't translate over exactly that way. So it may sound longer or shorter. But there were a few things here and there that just kind of in my mind I'm processing, thinking, I feel like I know a little bit of Spanish and I'm not sure that what I'm saying is being accurately communicated, but being unsure myself, I didn't feel, I didn't really know how to address that, so I just didn't. And yeah.
Did anybody else? I thought there was someone else who had that shared experience. Yeah.
I feel like very much like Chelsea. I let it go because again, I've worked with interpreters before where it's like, they'll say something like interpreter needs clarification. And so I wasn't sure, it'd be like a back and forth between the interpreter and the client. And I wasn't sure if they just hadn't let me know that they were just trying to clarify. And so, it's like I wasn't sure. And also at some points it seemed like the client was giving a very long answer and then I was getting a very shorter.
Yeah.
And I didn't know if it was also just that because of how much information they got that they were kind of condensing it down to give it to me.
It just reminds me of social services that we provide services for home visit, like children who are visiting their parents, and the caseworker has to watch the whole 4 hours, and the interpreters actually have to interpret every single word that the patient say, the family say, even they don't meant to communicate, and the interpreter did not know about that. All of a sudden we get a feedback from the caseworker saying that do not send that interpreter again. And of course I was like, may I know what the issue is? And she's like, well, when the child is talking, she's not interpreting. And when I asked the interpreter said the child was, playing and he was talking to mom, yelling at mom something, and the caseworker is just taking notes. So I did not know that I should interpret that. So as a caseworker, she has to document everything, anyone that say any word in the house, but that message hasn't been communicated to the interpreter. So it was, very honest that the interpreter didn't know that she has to interpret every single thing that is being said. So I would, recommend or that you can, jump in and, I think you can say that, I just want to make sure that this has been communicated and the client understood it and you felt good about it, because you don't want to leave the session and not feeling very good about if the interpretation went really accurately or not. So
I think always follow your intuition, and also remember that as an interpreter we come in feeling like we're part of your team, not part of the consumer's team. We're part of your team. And so if just as you would ask something to change of a colleague in the room to do something a little bit different to help you or whatever, consider it the same way. If something isn't happening in your session that your intuition is screaming like something is not right here, then ask the interpreter, talk to communicate with the interpreter, ask questions, and hammer it out. That's okay. Interpreters have really thick skin. And we, as I said early on, we have the same goal. We want to make sure that the services are given to the best of our ability and to make sure that the members of the communities that we work with are receiving the service that they deserve and need. We're at the end of our time. Were there any questions that weren't answered?
The phone is not answered. That's true.
It's been pretty busy.
So when we're talking, because one of the other things that came up was, do I look at the client or the interpreter? And I think so really we should be talking with the client the whole time, and the interpreter is kind of an extra in the room is the goal, right? Yeah.
And also use the first person. So
Oh,
a
yeah.
lot of provider.
Oh, yes, say
you
she.
know,
Mm-hmm.
Oh, can you tell her? Can you ask her? Instead of that, because you're looking at the client directly. So, how was your weekend? How is your son? Instead of saying, can you ask her how was her weekend? You know, so you
great.
just use the first person, speak to the client directly. That is, that's nice.
In my world, if the interpreter steps out of first person and goes into a narration of what's happening, that means that is cultural mediation for us. So a quick example would be when I was working at Behavior Corp, and the therapist would ask a question, the deaf person was looking to the side, like not looking at me or not within the linguistic field, and that was an indication to me that they were looking at something that wasn't there. But I had, that wasn't a sign,
Mm-hmm.
so I had to step out of the first person. I had to become the interpreter again and communicate with the psychiatrist, saying, you know, she's talking about this and this and this, but she's looking off to the side as if she's talking to somebody who's not there.
Mm-hmm.
And I had to give that information. And then I stepped back into first person. So if that happens from the interpreter's standpoint, probably there's more information the interpreter is trying to share with you as the clinician or the therapist.
Oh, that's helpful.
There's so much more we
I
can
know,
share,
I
so
know.
much. But we are here for you if you have questions, if you have concerns, if you have great things to share with us about the interpreters, that would be awesome. We don't always want to go to them with the bad stuff, of course. And just remember again that our goals are the same, to make sure that your clients' needs are met.
And the other thing is also
Yeah.
that you have bilingual staff as well, right? So
Mhm.
we, you know, if you're using them as, you know, language, you know, bilingual staff, then we also have the training at the Luna office that you can always send them as well. Yeah.
Great. Thank you. Yeah, we have appreciated the relationship with Luna and being able to offer that here. So, yeah, you guys have been awesome. So we appreciate this training too.
All right. Thank you so much for your time. You gave up a Friday lunch.
Yeah.